talking with Dr. Hood today about upper respiratory infections in dogs. So tell us a little bit about yourself, Dr. Hood.
Perfect. Yeah, absolutely. I'm Dr. Hood. I'm a recent graduate from Texas A&M. I've been working with Summer Creek Animal Clinic for about 5 months now, loving it completely. I'm interested in small animal medicine and love surgery, internal medicine, all of those good things. So happy to be here.
Yay! We are so happy to have you. You've been such a great asset to the team, and we're so grateful that you joined with us in working to provide fear-free care here in Fort Worth.
Thank you.
Yeah. So let's talk about respiratory infections. I'm sure a lot of our clients have seen, and I'm sure you've seen the news stories going around about this mystery upper respiratory infection. So what is an upper respiratory infection in dogs?
So an upper respiratory infection essentially could be an underlying viral cause, bacterial cause that can affect basically what we call tracheal bronchitis, where essentially it can affect anywhere from the back of the airway to the trachea, the sinuses as well, and can go as low as to lower airway as well. The upper respiratory infection, typically we think of nasal discharge, things up in the upper respiratory system.
Okay, and then what are some of the conditions that affect dogs that fall into upper respiratory?
Yeah, great question. So when we think of upper respiratory infections, one of the most common ones is something like kennel cough. And kennel cough has, a broader umbrella term for any underlying bacterial or viral infection that affects the upper respiratory system. Another cause could potentially be canine influenza virus, which could also lead to lower respiratory symptoms too, but those are really common things that we can see.
Okay, so how do dogs typically contract upper respiratory conditions?
Yeah, so they usually will contract it by respiratory secretions from other animals. So if they're specifically going to like a boarding facility where there's a lot of other dogs, a dog park where they have contact with a lot of other dogs, or grooming, training, something where there's just a big population of other animals, that's where they typically will contract it.
Okay, and what are some of the signs and symptoms that people should watch for in their dogs?
So signs, symptoms, I briefly mentioned earlier, usually is like nasal secretions. It can be either very watery secretions, sometimes nasty and kind of mucoid, eye secretions as well, or discharge. They can have a cough, they can have a sneeze as well. Sometimes it can even progress to where they have some respiratory distress and some struggling to breathe as well. So those are the main symptoms to look for.
Okay, and what should owners do if they see these symptoms?
If you note these symptoms, make an appointment with your veterinarian right away. Better, even if it's a mild cough or maybe a little bit of discharge, to just have it checked out early, have your veterinarian listen to their lungs, and make sure everything's A-okay, even if they're mild symptoms.
Okay, so fast action is best. All right, perfect. And then what about this mystery virus? Should our clients be worried about it?
So mystery virus, it's unknown, bacterial versus an actual virus at this time. A lot of patients in other states have been identified with this illness, and it's been, worked up as far as it's not kennel cough, it's not influenza. So at this time, it's no reason to panic, but there's a lot of steps that you can take to make sure that your pet is healthy and protected against any sort of respiratory virus or bacterial infection.
And what are some of those steps?
Yeah, great question. So those steps would be, make sure that your pet is up to date on all of their vaccines. Canine influenza virus, if their lifestyle requires it, meaning that they go to boarding facilities or training facilities where they have contact with a lot of other dogs, I would be up to date on your canine influenza virus vaccine. The other one would be up to date with your kennel cough vaccine. So your Bordetella vaccine is a really common one. So make sure your pet's up to date on all their vaccines. If you can, over the next few months, sometimes there's even recommendations to avoid big populations like boarding your pet or going into grooming facilities, things like that, if you can avoid it. That way they're not having contact with those other respiratory secretions, and it decreases their chances of becoming infected too. And whenever you do notice symptoms, just like we had talked before, take to your vet immediately so that we're not letting any potential infection get worse and progress into something like pneumonia or something a little bit more aggressive.
Fantastic. Thank you so much. I hope this is helpful for you guys. Don't panic if you see a cough. Just give us a call and we'll get you guys on the schedule to have Dr. Hood or one of our other veterinarians get your pet the meds that they need. All right, thanks.
All right, thank y'all.